Hello teacher, I talk about neonatal lupus. I study in Catholic University, Nursing School, St. Vincent of Paul. My name is Nadia Barriga Mendez. My teacher, Master John Moscoso. Definition: and condition that in some time observed in children born to mothers with lupus erythematosus, characterized by a rash similar to the of the discoid lupus erythematosus, with levels of elevated antinuclear antibodies and cells, and less frequently with hair block and other alteration of driving hepatosplenomegaly and pericarditis.
Normally, the body's immune system makes proteins called antibodies to protect it from illness. The antibodies attach themselves to harmful bacteria and viruses called antigens, which can cause illness. Lupus is a chronic autoimmune disease, which means the immune system mistakenly attacks healthy body cells and tissues without the presence of antigens. When this occurs, the antibodies are called autoantibodies. The result is inflammation and injury to cells and tissues that can lead to symptoms of lupus. There are different types of lupus. Discoid lupus is usually limited to the skin. Symptoms include a rash that appears as round, red patches on the face, scalp, trunk, or extremities. Usually, discoid lupus does not involve the body's internal organs, but the rash may be accompanied by joint aches. Systemic lupus erythematosus, SLE, can affect any organ or organ system, and most often results in episodes of inflammation in joints, tendons, and other connective tissues. Symptoms vary, such as fever, fatigue, weight loss, joint and muscle pain, swollen glands, hair loss, and nausea and vomiting. Because there is such a range in symptoms, the disease can often mimic other illnesses. The most characteristic symptom of SLE is a butterfly rash that appears in the cheeks and bridge of the nose. The symptoms can flare and remit over many years. The causes of lupus are unknown, although scientists believe that heredity and environmental factors are involved. This disorder is most common in women who are in their 20s and 30s. In some cases, lupus may be induced by certain medications. Lupus is diagnosed with blood tests and other diagnostic studies. It can be treated with medication according to the severity of the disease and symptoms.
Signs and symptoms. Number 1. In the second and third week of life of the baby can be seen skin lesions and are presenting as blazers of the subacute cutaneous lupus. Number 2. Hair shape. This vision made by blocking hair, this being the most dangerous manifestation without appropriate care may cause the death of the infant.
Lupus affects over 5 million people worldwide. You may have heard of it. You may know someone with lupus. But what is lupus? Let's take a look. This person is healthy. Hello! Everybody has white blood cells. They protect people from infections. This is what stops you from getting ill. In people with lupus, however, the white blood cells aren't so helpful. The white blood cells are out of control. They won't just attack infections, they'll attack anything. This is what causes all their symptoms. Symptoms of lupus can include extreme fatigue, joint pain, muscle weakness, rashes, hair loss, and it can also damage organs such as the kidneys, heart, or brain. There are a few things that can trigger symptoms in lupus patients. One of them is the sunshine. About 60% of lupus patients are sun sensitive. Another trigger is stress. It is very important that lupus patients take good care of themselves physically and emotionally. At present, there is no cure for lupus, though it can often be managed through treatment. A big problem is that it takes an average of 7 years for somebody with lupus to get a diagnosis and receive this treatment. You can help to reduce this time by sharing this video and raising awareness of this condition. Lupus mainly affects women, but it can affect anybody. To learn more, visit us at www.lupusuk.org.uk.
Application in medicine. Drugs play an important role in the treatment of lupus. Anti-inflammatory drugs, non-steroidal. Corticosteroids. Corticosteroids are hormones that are in the body. Artificial versions are used to reduce inflammation, sensitivity, and pain in many parts of the body. Agents, immunosuppressive agents, chemotherapy. These agents are used in serious lupus cases when more important organs do not work well and other treatments do not give results. Transplantation of bone marrow and peripheral blood cells.
Hi, I'm Laura. I'm 28 and I've been living with lupus for about 10 years. Lupus can cause lots of different symptoms. I mostly have difficulty with extreme fatigue, pain and weakness in my muscles, mouth ulcers and kidney problems. Lupus can also cause hair loss, skin rashes, seizures, blood disorders and can attack other organs. Like many people with lupus, a lot of the time I have no visible symptoms, so I don't look unwell. In fact, I often look really healthy, despite feeling awful. This generally makes it a lot more difficult for other people to understand my illness. When people ask me how I am, and I tell them that I'm really fatigued or in pain because of my lupus, I will often receive comments like, "You look okay to me," or "Maybe if you had a more positive attitude you'd feel better." These types of comments are not very helpful and make me feel much less able to ask for help if I need it. I find that the fatigue is probably the most difficult symptom I deal with from day to day. Lupus fatigue isn't just like normal tiredness. It makes me feel completely drained, and sleep doesn't make me less tired. I have to be very careful to pace myself. It's important that I plan how I use my energy. If I'm going out for the night with my friends, then I generally rest a day before and a couple of days after. Even then I struggle to keep up. When I have to leave early because of my tiredness, I worry that I'm letting my friends down and upsetting them. Like most people with lupus, I'm light sensitive. If I spend even a short amount of time out in the sun, then it makes me feel really unwell. Being light sensitive means that I often find myself trapped indoors. If I do go out in the sun, I have to make sure I regularly apply factor 50 plus sun cream, cover myself with clothing as much as possible, stick to the shade, and avoid the hottest parts of the day. Having to cover up like this makes me worry that I stand out. There are some things that you can do to help make things easier for people with lupus. First of all, it helps a lot when you know about lupus and its symptoms. You can learn more about lupus by going to the Lupus UK website, www.lupusuk.org.uk. You can also keep up to date on the latest news and helpful tips by following Lupus UK on Facebook and Twitter. Another way you can make things easier is to offer to help at home or in the workplace. Helping to lift and carry things can help reduce joint pain and fatigue. Giving a helping hand with the cooking and cleaning allows people with lupus to get more rest and manage their fatigue better. It's often not possible to tell how well I feel just by looking. I often look fine when in fact I'm really struggling. By asking me how I am, and by asking if there's anything you can do to help, you could make my day. Lupus is a chronic illness with no cure at present. For many people, it is a condition that has peaks and troughs, so they may have periods where they're relatively well and others where their symptoms are worse. Lupus is neither infectious nor contagious. Thank you for watching this video. Please help care for people with lupus by supporting Lupus UK.
Pros and cons. The pros: transplantation of bone marrow and cells of the peripheral blood for the reconstruction of the immune system and hematopoietic tissue. If the brother usage which has been given to this type of treatment but it is from an autologous allogenic. The cons: immunosuppressive agent, thermotherapy agent. They can cause serious side effects such as nausea, vomiting, hair loss, problems, bladder, decreased fertility, and increased rates of developing cancer and infection. Issue apply in Ecuador. The length affects one of every newborn 20,000 characteristic antibodies as anti-road, just the disease present in the scale for 1 to 2,000 people, but only 5% to 15% of these women have children, while then coming to the conclusion that there are more including factors that affect and cause the outbreak of disease. Treatment. The treatment of cutaneous neonatal lupus. The realization of an electrocardiogram is also important, and 3 days of gait to rule out an eventual VAF of first or second degree. Curative treatment. This treatment consists of fluorotonate corticosteroids since they are the ones who cross and placenta barrier to not be inactivated by placental hydroxylase.
Let's look at the rare and usually benign conditions known as neonatal lupus in this MDTV medical moment.
Lupus is not a hereditary disease, meaning it does not come about exclusively due to genes being passed from the mother and father to the baby. Instead, an offspring might acquire a genetic predisposition to lupus, but it takes environmental factors such as infections, stress, or certain medications to trigger disease. In fact, only 5% of offspring born to women with systemic lupus erythematosus develop the disease. Besides family and environment, other risks relate to gender, age, and race. 9 times as many women as men get lupus, usually between the ages of 15 and 30. And 4 times as many African American women as Caucasian women are diagnosed with lupus. There are, however, some risks of complications during pregnancy that are genetically determined. These can be investigated by blood tests. Approximately 1/3 of women with lupus have antiphospholipid antibodies that interfere with the function of the placenta by causing blood clots that obstruct the flow of nutrients from mother to child. Another 30% of women with lupus have antibodies to a part of DNA and its surrounding proteins known as anti-ROSSA and anti-LASSB antibodies. These antibodies carry an approximate 2% risk that the fetus will develop a rare condition known as neonatal lupus erythematosus, which is usually transient and not life-threatening. Most infants develop a skin rash and blood count abnormalities that disappear in 4 to 6 months. In a more serious manifestation, infants with neonatal lupus may develop a congenital heart block that carries a 15% fatality rate and may require a pacemaker after birth. Throughout the latter part of pregnancy, a progressively slower heart rate in fetuses suspected of having neonatal lupus helps to detect this disorder. In those situations, it helps to bring a neonatologist and possibly a pediatric cardiologist on board to consult with the medical team. This has been an MDTV Medical Moment.
Stay where you are. MDTV will be right back.
Conclusion. It will be advisable that all patients wait out autoimmune disease now, or why antibodies, anti-Rho, or anti-D positive, are followed by ultrasound serial during pregnancy in order to detect early changes likely to receive a curative treatment. VAV postnatal treatment is through the implantation of a pacemaker. Finally, the risk of children with neonatal lupus develop a less or other connectivopathia throughout his life seems to be low.
Lupus, or more properly, systemic lupus erythematosus, or SLE for short, is an autoimmune disease which can affect a variety of different organs of the body. Because any one person may have different disease components, lupus is often known as the disease of 1,000 faces. The cause of lupus is unknown, but is due to an abnormality in the immune system which causes it to attack one's own body. Areas of involvement can include the skin, joints, blood cells, kidneys, lung, brain, and more. Patients with lupus may describe pain or swelling in joints, rashes, difficulty being in the sun, pain or color changes to the fingers or toes in the cold, hair loss, sores in the mouth or nose, difficulty with breathing or chest pain, a history of blood clots, miscarriage, and more. While truly any area can be involved, many people only develop the milder components of disease. Who gets SLE? SLE occurs in 1 in 1,000 to 1 in 2,000 people. Most are women, with only 10% men. While commonly diagnosed in the third or fourth decade of life, youth and older individuals can have lupus. If you have any of the symptoms described previously, that does not mean you have lupus. In fact, most people with these symptoms may have other common ailments. Lupus is best diagnosed by a rheumatologist who can ask questions about your symptoms, perform an appropriate physical exam, and do investigations which only altogether can determine if you have lupus. There is no one blood test that can diagnose lupus. An ANA test, which is often associated with lupus, does not confirm a diagnosis of lupus. While a negative ANA test rules out lupus, less than 1% of those with a positive test have lupus. If you are diagnosed with lupus, there is treatment available and is guided by the manifestations you exhibit. Regardless of disease's severity, most patients will be started on an anti-malarial medication, hydroxychloroquine, which treats milder symptoms and may prevent more serious organ involvement. Anti-inflammatories can be used to treat joint pain. For more severe disease, stronger medications are often necessary, with examples including azathioprine, cyclophosphamide, mycophenolate, and corticosteroids. Please visit the website for information on all these medication options. While lupus can increase risk of death, the survival rates are 95% with appropriate treatment. Many patients will develop well-controlled disease, and some are able to achieve complete remission medication-free. For more information on lupus and its treatment, please visit edmontonrheumatology.com or speak to your doctor.
Thank you.